You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to. In the description below, you can find web links to all the websites, videos and resources that are mentioned during this video.
In section 1, we found out what is type 2 diabetes. In this section, we will find out what the common symptoms of type 2 diabetes are. However, some people may not have experienced any symptoms before they were diagnosed with type 2 diabetes. Feeling very thirsty and drinking a lot more than is usual for that person is a symptom, and or urinating needing to wee a lot more than is usual for that person is a symptom. It could be that person needs to urinate or wee more often at night time, maybe having to get up several times during the night. That can be a symptom. Extreme tiredness, a lot more than is normal for that person. It could be a real struggle to stay awake at times. That can be a symptom. Vision may be temporarily blurred if blood sugars are raised. If type 2 diabetes is causing blurry vision, the blurry vision should disappear once blood sugars are lowered. If your blurry vision does not improve, speak to your optician or healthcare professional, as there are other things that can cause blurry vision. Weight loss can be a symptom. Losing weight without trying. Sweating a lot more than is normal for that person can be a symptom. Wounds that are taking a long time to heal or infections that keep recurring can be a symptom. Wounds may occur on feet, but can also happen on any other parts of the body. Pins and needles or tingling sensations can be a symptom. Tingling or pins and needles seem to most commonly affect the feet and toes, but can also affect the hands and fingers too. We will now talk about how we can reduce the symptoms of type 2 diabetes. To reduce symptoms, aim for as near to normal glucose levels as possible. A healthy blood glucose level is between 4 and 7 millimoles per litre. Some people may have a glucose meter to test blood glucose levels. Not everyone will need to test their blood glucose levels at home. You will only be given a meter by your GP if you are on certain medications that require you to test your blood glucose levels. If you have type 2 diabetes and are taking certain medications that increase your risk of having a low blood sugar level, you will need to regularly test your blood glucose levels at home. Your GP or diabetes nurse will advise you if testing is necessary. Hypoglycemia or hypo. Some people with type 2 diabetes can be on medications which can cause a low blood glucose. Some people who take glucose-lowering medication might experience a hypo. Hypo is short for hypoglycemia, which is a blood glucose level below 4 millimoles per litre. If you take one of the glucose-lowering medications, your GP or practice nurse should have informed you. They may have supplied you with a blood glucose meter and asked you to regularly test your blood glucose levels. When experiencing a hypo, symptoms can vary, but may include feeling shaky, sweaty, having a headache or tingling lips, feeling irritable or confused or looking pale. If you are on a medication that puts you at risk of having a low blood sugar, your GP or practice nurse should have informed you. They may have supplied you with a blood glucose meter and asked you to regularly test your blood glucose levels. This now concludes section 2. Hopefully this has given you a better idea of what some of the symptoms are. In the next section, we'll be talking about factors that can increase the risk of type 2 diabetes.